Hello to everyone, and thank you for joining our webinar, RU Squared, Testing and Adjusting Imaging Systems with a Color Standard Slide. I'm Mark Clymer, the Director of Marketing for Datacolor Chromacal, and I'm joined today by Mark McNulty, the General Manager for Datacolor.
Hello all, welcome.
Today we're delighted to have Dr. Stefan Hammond as our speaker for the webinar. After Dr. Hammond's webinar presentation, I'll be providing a brief overview of Datacolor Chromacal, a new standard for color consistency in bright field microscope imaging, and then we'll have the Q&A session. Please use that question section in your webinar control panel to enter any of the questions, and we'll be addressing those at the end of the presentation. And now I'll introduce our speaker, Dr. Hammond. Dr. Stefan Hammond is a senior scientist in the Translation Pathology Laboratory at Biogen IDEC in Cambridge, Massachusetts. Dr. Hammond has been active in the area of systems pathology for over 12 years and has developed multiplex biomarker technologies for the first commercial prognostic prostate cancer test launched back in 2006. He received his PhD in molecular biology from the University of Hamburg, Germany, and completed his postdoctoral training at Yale University, where he developed technologies for expression profiling and mutational load distribution analysis. Dr. Hammond's current research focuses on the application of whole slide imaging and image analysis in the pharmaceutical industry. And now, here's Dr. Hammond.
Okay, hello everybody and welcome to today's seminar, RU Squared Testing and Adjusting Imaging Systems with a Standard Color Slide. Before I start, I would like to thank Mark Clymer and Mark McNulty to invite me today to talk about our experiences using the Datacolor system. First, I want to take a look at the bigger picture of digital pathology. And I think it's important that everybody understands why we are somewhat obsessed with having everything calibrated and working as accurately as possible. So digital pathology is, if you go to Wikipedia, it tells you it's an imaging-based information environment enabled by computer technology that allows for the management of information generated from a digital slide. You know, those are a lot of words, but I think to more crisper and shorter, it's the application of the principles of quantitative science and automation within the area of pathology. And I think the key word here is quantitative. So historically, pathology has been a really subjective discipline. And I think by adding the quantitative element to it, there's a lot to gain. And the reason why is, you might ask, why is it a good idea in the first place? Why not do pathology as it was done in the 20th and 19th century? So this is an interesting chart, and I talk from my experience in the pharmaceutical industry. If you happen to work in pharma, you know, this chart should scare you. It was published in Nature Drug Discovery in 2012, and it depicts the amount of drugs approved per billion of R&D money spent. And as you can clearly see, you know, this is a downward spiral almost. And so you get less and less drugs approved for the same money that you spend in research and development. And we have modified that chart a little bit by adding the technologies that were developed at specific time points. So starting at the early 50s, you have the structure of DNA, recombinant DNA, DNA sequencing, PCR, and then in the 90s, RNA inhibition, next generation sequencing, and now in 2014, 2015, you can add genome editing, which is the next big thing on the horizon. But chances are even this technology won't be able to reverse the trend. So of course, this is not a sustainable situation. So the question is, why is that? Why didn't have those technology the impact that it was, you know, that everybody expected? They haven't really facilitated drug development. Well, and we think the reason is because they all lack morphology and the context of morphology. So if you, for example, if you use tissue and do the usual grind and bind assay, you know, and do transcription profiling with it, what you usually do is the equivalent of taking the Mona Lisa and reducing it to the 3-color histogram in Photoshop. So you take the red, green, and blue histogram, and you extract it from the Mona Lisa, and obviously something is missing there. Something is getting lost, and a really important part of it. So you can say molecular-based technologies like transcription profiling have a high performance verification, which means they are highly reproducible and very quantitative, but they don't deliver the context. While anatomic pathology is exactly the other way around. You have low quantitative assessment, but high context. So what has to happen is to transform pathology into a quantitative science that you have high performance verification and high context at the same time. And if this happens, then you can predict that all those low context technologies like genomics, transcriptomics, and proteomics are being tied together by morphology and therefore become more context dependent and hopefully will facilitate drug development. Now, digital pathology rests on 3 pillars, and all of them are equally important, but I think quantification is the main key here. So we have standardization, quantification, and automation. And all of them are kind of tied together in the lab environment. And if you look at quantification, for example, at the TPL here, we have managed to automate the entire histology workflow. Starting from slide sectioning, we use the Curabo sectioner, slide staining, which is done by Ventana stainers, and slide scanning, where we have a bunch of whole slide scanners. And then finally, the automated image analysis, which is computer-based. Now, if you take that workflow seriously, it's not enough just to let the machines do the work. You have to add quality control at each step. So with slide sectioning, for example, you have a pathologist who reviews the slides and make sure there are not any wrinkles introduced that will, alter the results. For the slide staining, you always add a positive and a negative control slide. But how do you really quality control the performance of your slide scanning? For lack of a better word, they're really black boxes where you put the physical slide in on one end, and then you have to trust that the digital slide that comes out on the other end is really an accurate representation of what's going on in the tissue. So, but can you be sure about this? So this is what my presentation is focused on today. So we have 3 slide scanners at the moment in our laboratory. One is the ScanScope XT from Aperio. Then we have 2 panoramic 250 scanners and 1 Olympus VS120. Now all of them are slightly different, and each of them has the pros and cons. The ScanScope XT is more like a workhorse, very reliable, but only does bright field. The panoramic 250 does both bright field and fluorescence and is very fast. And the VS120 is really a high performance but low throughput fluorescent and bright field scanner. So the thing that really keeps me up at night is how accurate and linear are these really? And even if they are linear the day you receive them and they're set up in your lab, do they really stay linear over time, or do they deteriorate? Or if the optics goes out of whack, how do you know? You really don't check that every day. So the question is, how can we find this out? And I was always looking for a solution to this question, and until finally last year in June at the Society of Toxic Pathology meeting in Washington, I ran into the data color folks, and I talked to them, and they told me they have developed a standard calibration slide, and I would be interested to test them. And that was exactly what I've been looking for quite a while. So what you can see on this next slide is actually a prototype of a glass calibration slide. I have to add that the initial model was the chip was printed on an alloyed metal, so it's black, and that was originally developed for microscopes. We tested that too, but the scanner had problems focusing on that particular slide model. So, but the folks at Data Color, they were really responsive, and they provided me with this prototype where the chip is actually printed on a glass slide, And if you look closely, you see there's a circular cover slip around that chip. And it's because it's a prototype, it says data color confidential here. But now I've been told that actually this slide has gone in production, is readily available for purchase. So this is a close-up. So here in the middle of it, there's a 4x5 color grid. And you see it more clearly in this close-up. So this is used for the color calibration, those 4x4 colored dots. And the imaging system test is actually done with those 4 dots on the right-hand side. So this is the diagnostic feature, and this is the color calibration feature. Just to prevent any misunderstandings, I'm only talking about the diagnostic feature, which is provided by the right-hand side dots. We're not using yet the actual color calibration, so meaning that the digital slides are color calibrated themselves, because we have some compatibility issues with the slide format provided by the whole slide scanners. But if you use TIFF or JPEG images, you can actually use the color calibration feature as well. So the way this works is you scan this calibration slide and import the data file into the color calibration system software. And I found it very intuitive and easy to use. You can learn this in about 10 minutes. Once the slide is uploaded, you adjust the matrix grid. This is this grid of those squares here, and you can adjust them and stretch them in any direction so they fit the grid of your of those dots. And then the software will tell you whether the matrix alignment is good, meaning that those squares are really right in the middle here. And then if you go to tools and display the alignment graph or the linearity graph, then it will pop up this window which says imaging system linearity check, and displays the slope and the R squared for each of the 3 colors, and give an estimation whether the linearity is within tolerance, good, or out of tolerance, so poor. Yeah, and we can also export all those values as an Excel file, a CSV file format that can be imported into Excel. So on the bottom here you see the 4 grayscale dots, patched 17 to 20, and those 12 values that are exported. I think it's a very useful feature because you can create a database and watch the performance or control the performance of your imaging system over time. So let's take a look what it looked like when we checked our 3 scanners that we have in our lab at the moment. So the ScanScope XT and the Panoramic 250, if you look at the images, they look very similar, but the VS120, you can see right off the bat there's something strange about it because the colors are much more vibrant and looking and much brighter. So if when we check the linearity plot of each of those, the ScanScope XT was within tolerance. The Panoramic 250 was good, which was a relief for us because first we have 2 of them, and secondly they're brand new and they cost a lot of money. And then we thought, okay, what's going on with the VS120? And we were kind of shocked and surprised to see how off it was really displayed in the linearity plot, and was actually categorized by the data color software as being poor. So yeah, I sent an email to Olympus and asked them for advice and what is going on here. So it took them a couple of days to get back to me, and they told me, well, I have to add we scanned this with the default setting, so the gamma was set at 1, and they advised us to set the gamma below 1, so which indicates to me that the default gamma 1 setting is not really 1, it's higher than 1. And you can see the typical slope here, which you see a higher intensity at the lower values, and then it's kind of slowly leveling off, which indicates to me that gamma 1 is rather gamma 1.5 by default in the VS120. And I can only guess, don't want to assume anything, but I guess they did this to make the colors more vibrant looking and nicer for the observer, but it's really not a linear response. And I will say there are two ways to do imaging. One is to create nice pictures for the cover of Nature magazine, and the other way to do imaging is to create data, and we are really interested in accurate data. So we did a number of tests where we acquired the calibration image at different gamma settings. So again, this is gamma 1, where we initially started, and we set it at different levels and checked the linearity, and we find that at 0.5 we reach a maximum of linearity for green and the red channel, although the blue is still off. But as you will see in a moment, for the experiment that we were doing at the time, the red channel was the most important, so we set it to 0.5. And that was in December, and we just had acquired a whole data set with the default setting at the Olympus. So we set the gamma 2.5 and repeated the entire experiment in order to see what kind of influence it really had on the data. So this is the experiment we were working on at the time. And this is the bleomycin mouse model. And what you do there, you inject bleomycin, which is an anti-cancer and antiviral drug, into mice, and it has the side effect that it induces dermal fibrosis. So dermal fibrosis is characterized as an increase of thickness and dermal deposition in the dermal region area of the mouse skin. So this would be this area over here. And then you section the mice and stain the collagen with picoceres red. So that's the reason why the red channel was important to us. And then use image analysis to identify the dermal region and set a threshold to identify the collagen area and the areas where there's no collagen. So we did this, as I mentioned before, we did this with the adjusted imaging system and the one that was not adjusted, and then we compared how, if any, influence it had on the results. So this is Does It Matter Part 2. So this is with the non-adjusted imaging system with the gamma set to 1, the default setting. And what we compared was the relative area of the PSR stained collagen in the dermis. And over here on the left-hand side, this is the saline treated. So this is the control mice group. On the right-hand side, this is the bleomycin group. And you can clearly see there's after 28 days in the bleomycin group, there's an increase in the relative area of the PSR stained collagen. So this is the imaging adjusted data series, and you see there's a definitely increase in linearity at gamma 0.5 in the system. And right off the bat, you see that the relative area values are much higher in the adjusted imaging data set. So here you have like between 35 and 55% relative area, and here is much higher. It's like 75 to 85. But that might be like a direct side effect of adjusting the gamma because it makes the image darker and using the same threshold in the image analysis, so you pick up more collagen. But more significant is that you see an artificial compression in the control group over here where the imaging system is non-linear. So this seems to be clearly an artifact of the imaging system not responding to red values, while here you have a stretched out control group. And also the error bars, of course, become stretched, and you have one mouse here which is outside the standard deviation in the control and the treatment group. Now you have to keep in mind, this is just control and treatment group, but you also have, in a standard experiment, you have additional groups that are treated with an agent that is supposed to prevent fibrosis. And once you have and they ideally are between the control group and the treatment group. So once the standard deviations start to overlap, you usually are in an era where you don't have a statistical significance in the treatment effect. So if you have a nonlinear system, you would actually artificially get a positive result, where in the adjusted system you might get a non-significant result and a false one. So I would say absolutely it doesn't matter that your system is linear, because it can go either way. You get a false negative or a positive result depending on the particular layout of your experiment. So yeah, so that's the lesson in today's webinar. So it absolutely doesn't matter to have your imaging system adjusted to a linear response. At the end of this short webinar, I just want to stress one more thing. When you purchase this calibration site, you also have the you are also provided with the calibration sensor that adjusts the color response of your monitor. And on top, so this is my office here, and that's kind of the place where I give the webinar at the moment. And you see, I have quite an array of high-resolution monitors. And what always bothered me is that each of them displays the color in a quite different way. So one is more, on the greenish side, one is more reddish-looking, and you never can be quite sure which of them is actually displaying the colors in an accurate way. And if you, like me, spend a lot of time evaluating stains on a digital slide, it really gets in the way. So what you can do is with this color calibration sensor is you can hold it in front of the monitor, and it's connected to your computer with a USB cable. You hold it in front of the monitor, and it will the software will display colors in that area here, which is picked up at the sensor, and it will automatically adjust the color to your monitor to display all colors accurately. So white is really white, and the colors are displayed as they should be. And then all of a sudden, all your colors, all your monitors look the same, which is really, a huge benefit. And I was really surprised how off my monitors were. They were really way too much on the red side, and because I spent so much time every day working with them, after a while I didn't realize that. So yeah, I think that's absolutely something that is very helpful. And that also has another sensor in the front end which measures the ambient light in your working space and tells you whether it's too bright in there or not bright enough. Yeah, so let me sum it up. So the accuracy of tissue biomarker quantification requires linear image acquisition. I think that everybody understands that. But it may come as a surprise to some that the imaging systems are not always linear by default, as you get them from the manufacturer. However, it is possible to judge, not possible to judge the accuracy of your imaging system by just looking at tissue images. You would never notice the difference. But a standard color slide can be used to verify and adjust the linearity, as I hopefully demonstrated to you convincingly. And something I would be looking forward in the future, if some of the manufacturers might be listening in today, if they could consider integrating something like this into their software, so that you can, create a calibrated environment every day by default by using the slide scanner. So if that's kind of integrated into their system, that would be a huge help for the workflow. And before I hand it back over to Mark, let me just share some images from snowy Boston. We had like a record snowfall, 70 inches in just 18 days. There's a couple of shots I took just after the first blizzard, and after that we got hit by another two. So you can imagine what it looks like now. So yeah, thank you so much for listening in. I hope you found some useful information, and I'm looking forward to answer your question. I'll hand it back over to Mark.
All right. Well, thank you, Dr. Hammond, for sharing your experience with us and for describing your use of the Chromacal tools and capabilities to identify and monitor and correct the color delivered by your imaging systems. And we definitely wish you best of luck with the impending snow that Boston is still due to get. What I'd like to do now is give a brief overview of Chromacal's capabilities. Chromacal solves the dilemma of color consistency across the imaging continuum by combining standards and software and sensors to objectively deliver consistency in your imaging and your images and ensure that your images are properly displayed for your evaluation. ChromaCal helps you better manage your imaging process from setting up image acquisition all the way through image presentation. Let me show you the diagnostic features that Dr. Hammond uses for his work, and then I'll provide a quick demonstration of the image calibration software. As described by Dr. Hammond, ChromaCal offers several diagnostic features that help you manage the quality of your imaging. The main screen of the ChromaCal software tells you if your calibration slide is linear and properly exposed. You can see that here in the lower left. The linearity plot that Dr. Hammond also illustrated allows you to visualize the red, green, and blue color components of the neutral patches from the slide image and the fit of those data points. As Dr. Hammond demonstrated, this is very useful when assessing or adjusting your imaging system to deliver linear images. New to the latest version of software is the ability to export the image statistics for the open ChromaCal slide image. Along with the diagnostic information, the red, green, and blue values for each color patch are recorded. And with this data, you can compare performance of an imaging instrument over time, or even compare one instrument with another. So this data includes not just the neutral patches, but also the 16 color patches. Monitor calibration is critical to both viewing images as they're intended, but also during image capture, since we use the image on the monitor to make judgments about our acquisition settings. When you think about it, our monitors also use color to make the white, the black, and all the gray tones in between. So calibrated monitors also help to accurately display monochrome images and electron micrographs with their full tonal ranges. Unlike software and operating system-based adjustments, ChromaCal monitor calibration uses a sensor just hanging here on the front to measure your monitor's ability to display color. And since this ability deteriorates over time, it's a good idea to recalibrate every few months. It only takes 10 minutes. Additionally, the truer the color rendering of your computer monitor, the more consistent and accurate your printouts will be. Image calibration uses the ChromaCal calibration slide and the image calibration software. The calibration slide is available in black metal for conventional microscopes, or as Dr. Hammond pointed out, and you're using whole slide scanners, we offer a special customized glass slide. The process for standardizing the color in your bright field images is really quite simple. Just capture an image of the calibration slide and capture images of your specimens. The image of the calibration slide serves as the color fingerprint for your imaging session. The image calibration software uses that color fingerprint and the known color characteristics of the calibration slide to create and apply a color profile to copies of your specimen images. And that's it. Now you're ready to evaluate, analyze, report, and present those calibrated images. So here on the right is an enlargement similar to what Dr. Hammond displayed earlier of the calibration area of the slide. There's two matrices that are available, and you just take advantage of whichever one fits best into your imaging field of view. The color circles on the physical slide have measured spectral characteristics and serve as the standard to which the ChromaCal image calibration software will compare the color fingerprint. So here on the left is also the black slide and the glass slide for WSI. Now I'd like to take you on a really quick tour of the ChromaCal image calibration software, and I'll show you just how easy it is to standardize the color in your bright field images. So here's the software. You'll see that when you launch your software, it gives you an indication of whether your monitor has been calibrated or not by ChromaCal. First step is to open a calibration slide image, and I have an image right here. And you'll notice when I open my image, I've already told the software that the serial number for this particular calibration slide by indicating this, it knows what those values are for that particular calibration slide. First step is I want to enlarge my matrix, and I just click and drag over that and it enlarges. And you can see that not only did it zoom in on the image, but I've done this once or twice, and I'm able to align it into my little regions of interest here, which are sampling the colors. You can see that these change from orange to blue, and that my matrix alignment now says good. You can also see that I've got good linearity and good exposure for my image. Dr. Hammond also mentioned about the linearity plot, and that's available here, and this is for this particular image. These are the statistics along with the individual measurements that would be available if you choose to capture those slide statistics and export them in that CSV file and then use for downstream quality control and color adjustment in your systems. I'm not going to download that. Next step is to calibrate an image. So I'll first take you through a single image calibration. I choose a JPEG or TIFF image and open that image, and that fast I have a calibrated image. On the left is the uncalibrated image, as if you were viewing it in PowerPoint or Photoshop. On the right is the calibrated view of that image. We've got some tools here for zooming and panning, and you can do this on either window and move it around, and you can take a look at that. We also have full screen mode and can toggle back and forth. Reset will bring it back. We have save the entire image, but if you choose also to zoom in, you have the ability to save that cropped view. So it's really very user-friendly and easy to save certain regions of interest that may be useful for your downstream evaluation. We also have contrast, and the way we handle contrast is we don't adjust the ratio or the relationship of your red, green, and blue channels to one another. We maintain that throughout the contrast range. Also, there is a reference standard label that can be included or not on your images. So that is single image calibration. I'm going to now demonstrate what I feel is very useful, and that's batch image calibration. And in doing this, I just picked the source of my images. And I'm going to go ahead and I'll save these in another folder called Calibrated Images. It makes sense. So when I'm ready to calibrate, I can first take a look at each of these individually. You can make adjustments, again, individually, choose whether or not to include your reference label. Also, in the case of TIFF images, you could, if you feel that you'd like to save some storage space, you can save those down as JPEGs. When you're ready to calibrate your images, simply press the Process Images button, and ChromaCal goes ahead and does the work by itself. If you've ever used Photoshop to adjust your images, you'll notice that ChromaCal just calibrated 7 images in less time than it takes to launch Photoshop. So let's take a look at those images. Under here in Viewer, we have our ChromaCal Viewer. We add our images by selecting the folder where those images may be located. We continue to add images if we like. Anything that's TIFF or JPEG can be displayed by ChromaCal. So here, if I choose one image, just Snap 16, you'll see that I also have the respective original image here, Snap 16. And once an image has been calibrated by ChromaCal, it's actually a copy of the image, so it never touches the original. And then it saves with an appended file name, so you can always you're always readily aware of whether that image has been calibrated or not. Importantly, in the metadata of the calibrated image are a number of specific details related to the calibration. So there's excellent traceability and documentation related to the imaging, the calibration of the images. We also have a filter here that if all you would like to do is show the calibrated images, you can turn that on or turn that off. One other thing, again here, as we did in the preview of during calibration, you can zoom in and you can save the regions of interest. You also have the ability to, again, view in full screen. So that is the demonstration of ChromaCal. You go back to the presentation. Again, if you have any questions, please submit those into the question area of your control panel. So the diagnostic features of ChromaCal allow you to document, monitor, and even control the performance of your imaging systems, including whole slide scanners, as well as conventional microscopes with digital cameras. With ChromaCal, also you can be assured that your monitors are displaying your images the best they possibly can. And image calibration standardizes the color in images that seemingly unlocks hidden details, as well as providing more consistent results between imaging sessions and imaging systems. With ChromaCal, you'll have greater confidence when acquiring, viewing, and evaluating your images so that you can focus on your research. We'll take your questions now for both the webinar presentation and the overview of ChromaCal. Please use that question section of your webinar control panel to submit your questions. If you like, you're also welcome to contact me at any time directly following the webinar. While the questions are coming in, I just wanted to mention that Datacolor will be exhibiting at the upcoming Society of Toxicology meeting in San Diego in March. And at SOT, we'll be sponsoring a seminar on Tuesday morning entitled Application of Color Calibration and Photomicrography for Toxicologic Pathology. We're excited to have Dr. Ward Richter as the speaker for this seminar. So if you're at SOT, please stop by, say hello, and make a point to stop in and see this seminar. Okay, so now we'll address any questions that have come in. I have to find my control panel. Okay, quite a few questions. So let's take these. There's a question about the sensor alignment. I think regarding the monitor calibration, and Dr. Hammond, I'll take that. What Dr. Hammond was illustrating is how you place that sensor in the software when you're calibrating your monitor, and it's very easy to do actually, and it'll just hang there against your monitor. There's a little template, a little shadow that you place the monitor on top of. Okay, another question. When calibrating some monitors, they're asked to adjust brightness, and some monitors cannot obtain a desired level of brightness. How does this affect calibration, and what do you recommend? I'll take this as well. Some older monitors aren't able to achieve what they call white point, so the brightness, and it's just the ability of your monitor does deteriorate over time. The calibration will proceed. It'll do the best it can. It'll just reset your white point, but that could be a good indication, an opportunity to, if you have the funding, but request a newer monitor. Let's see. Okay, I have a question here. For users of image analysis software like Visiopharm, Halo, Definiens, or Image Pro, do you think differences in the linearity or nonlinearity of images could be meaningful in the results obtained by those applications? Dr. Hammond, I'm going to let you take that question, please.
Yeah, I think I've shown in this example during my presentation, we actually used Visiopharm to analyze those images, and we clearly saw a difference between the linear system and the nonlinear system. I think it's really important to be aware that it can have an impact on your results, and I think that's reason enough to have a linear imaging system going, really.
Okay, thank you. let's see. Easy question. Is the ChromaCal software Windows OS only? No, we support both Macintosh and Windows, and also, importantly, there is no licensing fee, so no annual licensing fee with our products. I have another question for Dr. Hammond here. Now that you've tested and established your linear states for your imaging systems, are you seeing any drift over time?
Well, we started taking that regularly in December, so we haven't really seen a drift over time. But what we did do is one of the panoramics had a camera malfunction, and we had to have that camera replaced. So we tested that new camera, and it turned out it was slightly better than the old camera. So I'm not sure what it does indicate, but I think if you have events like this, it's always advisable to recalibrate it or retest it once you get it back into your lab, just to make sure it performs the same way the old system did.
Okay, yeah, good. Here's another question. Do you think linearity plays an important role in fluorescence imaging, even though those images are really only grayscale?
I think even more so. I think it's important, and unfortunately, not sure if that same color calibration insight can be used for fluorescence. It's probably something Mark could answer, but we would really like to be able to use that in fluorescence as well to make sure our system is linear.
Yeah, I mean, I'll address regarding the ability to use the slide in fluorescence, and unfortunately, there's nothing on that slide that is fluorescent. It's intended for transmitted bright field. We have people asking us if it's also suitable for reflected light, but unfortunately, it's transmitted only. There's also a similar question asking about the 16 color targets. Is there a larger data set available? And we actually have data included in our patent applications that show that these are narrowband filters, but there's fairly good overlap, and it spans the 400 to 700 nanometer spectral range of visible light. So there really isn't much sense in adding any additional patches. These do a pretty good job, although there is work out there by other groups to look at additional approaches. Okay, let's see. Just one more question, and then we'll end. And Dr. Hammond, this will be for you. You've spoken mostly about whole slide imaging systems. Do you see the same need existing with traditional imaging equipment?
I think even, yeah, definitely, probably even more so, because there are a lot more variables there that will affect linearity, and especially if we have multiple users using the same microscope, and every body kind of changes settings on your system. So you really, once you start taking images, you really don't know where you are, and checking that with the calibration side, I think is even more important than a whole slide scanner, which has a limited user base.
Okay, great. Thank you. Thank you again for that. All right. Well, the recording of this webinar will be available to view from our website within a couple of days, and we'll be notifying everyone who registered for the webinar when that recording has been posted. I would like to extend a big thank you to our guest speaker, Dr. Stefan Hammond from Biogen IDEC, and I hope you do well in the snow in the upcoming days. And I'd also like to thank everyone who joined our webinar for taking the time and learning something about the use of ChromaCal tools in whole slide imaging and for imaging systems. Have a great day.